I'm Jason Karlawish, and I'd like to tell you the story of the most amazing woman, Hilda Pridgeon. She was courageous, she was smart, and she was a principled person. Our story begins in 1970, when she was a wife, mother to a teenage son, caregiver to her husband, Al, and an executive at the Control Data Corporation. And she came to realize, I can't do it all. The problem was Al. He had Alzheimer's disease, and as a result of his disabling cognitive impairments, it had reached a point where he couldn't be left home alone anymore. She'd return from her work they desperately needed to earn money to care for him and to live, but she'd find the lunch that she'd prepared for him uneaten in the refrigerator. He needed a day that was safe, social, and engaged. He had little to do at the house. And so what was she to do? She couldn't quit her work because they needed the income. She needed her career, but he couldn't be home alone. And so she sought help, and she found the Sister Kenny Daycare Center. And the challenge then, though, was how to pay for it. So she wrote to Medicare, and she appealed for them. She said, I know it's not a prescription drug, but it's the only prescription available for him for his treatment. But the man from Medicare, she said, wrote back to her and said that that's entertainment for Al and a relief for you, and we don't pay for that. To add to her indignity, he wouldn't even meet with her to talk about this. But this wasn't the first time she'd been told you can't. In high school, she'd earned the status of valedictorian, top of her class, but was told she would be the salutatorian, because the salutatorian would be the valedictorian because he was going to go fight in the army in the Second World War. Now, of course, she couldn't do that because she was a woman, and women weren't allowed to serve in combat. Despite being told you can't, it's not possible, she persisted. She and her friend, Bobby Glaze, would form the organization called the Alzheimer's and Related Disorders Association. This Minnesota-based organization was dedicated to educating healthcare professionals about the disease, educating families, raising awareness, promoting research, and creating a system of long-term care social insurance so families didn't have to suffer the way they did. This organization would be the template, the foundation, the model that would later be used to form the organization called the Alzheimer's Association. And Hilda would be a member of the Alzheimer's Association's board of directors. She would chair its chapter committee to oversee its chapters and their standards. She'd get her chance again to make her case to the United States of America for help. On April 3rd, 1990, she testified at the joint Senate-House hearing, Alzheimer's, the Unmet Challenges for Research and Care. And at that hearing, she would recount her story of caring for Al and the indignities that they faced. And then she went on to expand her vision. She talked about the national crisis, whose annual bill is nearly $90 billion. And she emphasized how this bill is largely paid for by America's families, paid for either out of their own pocket to provide care, as she had to do for her husband, or paid for out of the time they spend instead of working to provide care. People are afraid. I'm afraid, Hilda Pridgeon told the United States Congress. They're afraid of what will happen to them if they get this disease. They're even more afraid of how their families will cope. Even more afraid. That's what she said to the United States Congress, that the patients are even more afraid for their families about how the families will cope. She made her case for national long-term care social insurance. But of course, we know Congress didn't listen, and even today they haven't listened to Hilda Pridgeon. And yet America is listening, because she created the foundation that would lead to the organization and other activities that would raise awareness about this disease, such that now we have a national Alzheimer's plan, providing funding for research, organizing a national infrastructure for care, efforts to reduce the risks of developing cognitive impairments. So let us now, in the spirit of Hilda Pridgeon, that courageous, smart, principled woman, let's look forward to a time when we achieve her vision and create a system of national long-term care social insurance.